work with Center for Victims of Torture, which is an international NGO. And so I work to support local physiotherapists that are working in local organizations that are mental health organizations. So I help provide direct clinical supervision and training to build their capacity to provide physiotherapy services to the survivors of torture and war trauma. So with survivors of torture and trauma, we often find the comorbid psychological symptoms. So they have PTSD, anxiety, depression. So we find that an interdisciplinary approach is really essential. So all of the clients we work with have physiotherapy, but they also have counseling, social work, and legal support, financial support, because you need to address the whole person in order to address their functioning. So the biopsychosocial approach understands that the person has biological, social, and psychological domains, and that makes up their physical health and functioning. And so as physiotherapists, we need to understand all of the factors within those different domains in order to help bring them back to recovering to function. If we just focused on pain or just focused on the body information, we would not get the outcomes and function because it's just not enough. So the biopsychosocial approach, I think, is gaining a lot of awareness now in physiotherapy. I think the next step is really saying, well, what does it mean for us to treat in this model? We kind of understand, okay, we need to be doing biopsychosocial model, but what clinical skills do we need to develop? What competencies do we need to develop? And how do we apply that in our clinical treatment and assessment of clients?